Welcome back to New Day, everyone. California is now facing a statewide epidemic from whooping cough. There have been 800 cases reported there in just the last 2 weeks and more than 3,000 cases since the start of the year, including 2 infant deaths. Health officials are urging parents to vaccinate newborns as soon as possible for protection from this potentially fatal disease. Joining us to discuss and what you need to know is Dr. Alexander von Tulleken, the Senior Fellow at Fordham University. Good morning.
Good morning.
I can't believe this epidemic of 800 cases in the last 2 weeks. That should get every parent's attention, right?
Absolutely. I mean, this is a disease which is potentially fatal in newborns, so it is something that people should worry about and is preventable with a vaccination.
Why is it, first of all, let's go back before we go forward, why is it happening? We've talked about whooping cough forever, it seems like. Why are we seeing this uptick, do you think?
I mean, this is a disease that you normally think of as a disease of, you know, Dickensian orphans in Victorian England, that kind of thing.
Right.
Is it Charlotte Bronte's sister had it?
That's why we booked you.
Yeah, and that's what I'm going to talk about.
The accent.
Well, this is the, I haven't brought the whooping cough, fortunately. So I think we do see a resurgence every few years, that immunity seems to die away and the vaccines don't last as long as they used to. Additionally, we do have a modern phenomenon of these non-medical exemptions from vaccination, so parents who are reluctant to have their kids vaccinated.
Let's talk about that, because we do know that the facts are these. You do have this cycling, so it's not like this is new, so it's some kind of pandemic, but there is a big cut of the country that suffers from, subject to your opinion, misinformation about vaccines, and people aren't doing it. I think it's the new way toward wellness. Get away from the old thinking. Hasn't the science that suggested that you don't need vaccines been debunked? Isn't it very clear that you need vaccines?
The science is very clear, but what I'd say is these people aren't monsters. They're not trying to, and they're really demonized in lots of the press. And so you do have, modern medicine is very confusing. Big Pharma has historically been cynical, and lots of modern medicine doesn't work as well as you'd think. So I can see why people are suspicious. It's very confusing, but we know that vaccines work. They're not side effect free, but they don't cause these side effects that people are worried about, autism being the headline one. It's been incredibly well researched, and the original paper that was published by Andrew Wakefield that suggested
completely
that link, completely debunked.
But the passion and the fear there is so enormous. And, you know, you barely whispered the word autism. It was almost as if you were scared to say it out loud, but that's what is driving this for so many parents.
I'm an MD, I have a degree in public health, and I have a 5-year-old son, and I worry about all these things. I mean, these are things where they're confusing if you have medical degrees. So,
is he vaccinated?
He's absolutely vaccinated, and I would urge everybody to do the same.
Because it is particularly dangerous for infants.
Absolutely, absolutely.
If you have a kid who's playing with kids who haven't been vaccinated,
even if
are
your
they
kid's
at risk?
vaccinated?
Yeah, the kid's vaccinated, but his playmates are not.
This pertussis is the medical name for whooping cough. It is highly contagious. 80% of exposed people who aren't protected get it, so it's highly
80%?
Exactly. So one cough on a subway will infect 15, 20 people. So it is highly contagious. So if you are in contact with newborns, you should have the vaccine, full stop. If you're a grandparent, a sibling, you should be up to date with your vaccines. All pregnant mothers should be vaccinated. All children older than 6 weeks should be vaccinated, and all healthcare workers should be vaccinated. If you have a kid who's symptomatic, so what you want to do is surround that.
And it's not a lifetime vaccination, right?
It's not.
There is the booster you need to be worried about.
So that's the vaccination I'm talking about. Is if you're a grandparent, if you're a sibling, if you're a close relative who spends time with kids, you want to be, especially with the infants, because the infants are who we worry about. You want to get that booster shot.
What do you do once you get it?
Especially, what do you do for an infant once they get it?
Well, so the first 6 weeks of life, they can't be vaccinated. So you want this ring of protection of vaccinated people around the infant. But once you get, well, so there is what you call a catarrhal phase. So the first week or two, you're highly contagious and not very symptomatic. You might feel like you've got a cold, might have a bit of a cough. Now, this is not a reason to go to the emergency room, but it is a reason to go and see your family physician. And based on whether you've been in contact with people, what region of the country you're in, whether you're up to date with your vaccines, they may or may not treat you with antibiotics. They'll certainly be aware of it. If you have a sick child, again, if they've just got a runny nose, a bit of a cough, you'll know if it's whooping cough. If it's full-blown whooping cough, you will go to the emergency room. It's very distressing to see. If they've got a bit of a runny nose and you think think there's been an exposure, again, you don't need to flood, we don't want to flood the emergency rooms, but you should go and see your family physician if you're concerned.
And do all the common sense things. Get your washing hands down.
Wash
get the
your
coughing into your elbow
Washing
down.
hands, the coughing into your elbow is much more important. Most of this, it is transmitted a bit with hands, bit on clothing. Most of it's coughing and sneezing. It's droplet infection.
800 cases in just the past 2 weeks in California. Those numbers are staggering, and that 80% infection rate is pretty startling as well. Doctor, it's great to see you. Thanks so much.
Thank you.
All right.